Go ahead and pull off one sock right now, just one, and look at the skin where the elastic band rested against your leg all day. Do you see a groove pressed into your calf? A deep indentation that just sits there, taking 30 seconds, a full minute, sometimes 5 whole minutes before it finally fades? If that sounds familiar, I need you to stay with me, because what you are staring at is not caused by a tight sock. It is not caused by eating too much salt. And despite what the majority of people over 60 have been told for decades, in most cases, it has absolutely nothing to do with your heart. What you are looking at is a drainage failure, and the system responsible is one that nobody ever properly explained to you. Right now, as you watch this, there may be half a liter or more of fluid sitting quietly in the tissue around your ankle and calf. Not in your blood, not in your heart, but locked in the space between your cells. And tonight, the moment you lie flat, that fluid is going to move in a way that wrecks your sleep, adds unnecessary strain to your heart, and makes every health challenge you are already managing harder to control. I am going to show you precisely what is happening inside that ankle, why the advice you have probably received so far has not worked, and the simple 5-minute habit that can change how your legs feel by tomorrow morning. My name is Dr. Vanse, and before we go any further, I want to ask you to do one thing. Hit the subscribe button right now and tap the bell icon so you never miss a video. This channel exists to give you the real explanations behind the symptoms that are too often dismissed or mismanaged. If you want to keep seeing content like this, content that actually goes deep on what is happening in your body and what you can do about it, subscribing takes 2 seconds, and it makes a real difference. Now let us get into it, because what I am about to walk you through changes everything. You already know the feeling without me describing it. You get home after a long day, you kick off your shoes, and your ankles look wider than they did this morning. Your calves feel dense and heavy, like something is pressing on them from the inside. The rings on your fingers are suddenly difficult to remove. You press your thumb into the skin just above your ankle bone and watch it leave a little dent that takes an oddly long time to fill back in. You sit on the couch for an hour, and when you stand up, your legs feel weighted down. And if you brought this up at a medical appointment, there is a reasonable chance you were asked about your heart, told to reduce your sodium intake, and maybe handed a prescription for a diuretic, a water pill designed to make you urinate more frequently. For some people, that helps a little. For the majority of people over 60, it does almost nothing of substance. And here is the reason. The fluid accumulating in your legs is not in your bloodstream. It is in your tissues. A diuretic works by pulling water out of the blood. It cannot reach fluid that has already escaped into the tissue space. The compartment being treated is the wrong one, so the pill does not work, the swelling continues, and you are left with the side effects and none of the relief. Let me give you the explanation that actually fits what is happening. Your body runs 2 completely separate fluid systems. The first one most people know something about, the circulatory system. Arteries carry oxygenated blood away from the heart, veins return it. That system has a dedicated pump running every second of your life without you thinking about it. The second system is the one almost nobody explains. It is called the lymphatic system. Fluid is constantly leaking out of the tiny blood vessels throughout your tissues. That is not a malfunction. It is normal. That fluid, now called lymph, bathes your cells, collects waste material, dead microbes, and excess water, and then needs to be gathered up and returned to the bloodstream through a completely separate network of vessels. Your body moves about 2 liters of this fluid every single day through that system. Here is the critical part. The lymphatic system has no dedicated pump, no heart, no automatic mechanism pushing the fluid along. It moves when your body moves. Every time your calf muscle contracts, every time your ankle flexes, every time you take a step, those muscles compress the lymph vessels and push the fluid upward. Stop moving and the system essentially stalls. Sit still for 2 or 3 hours and fluid begins to collect in the lower legs because nothing is pushing it back up. When you are younger, this is not a serious problem. The vessels are flexible, the valves inside them close tightly, and a short walk gets everything flowing again within minutes. But after 60, 3 things happen simultaneously. The lymph vessel walls begin to stiffen. The valves start to lose their precision and allow some fluid to slip backward. And the connective tissue in the lower leg, which normally helps contain fluid in place, loses some of its firmness. Fluid leaks out faster than it used to, and the system moves it back more slowly than it used to. The math stops working, and the fluid accumulates. That is the mechanism. That is why your ankles look bigger by evening and smaller by morning. You spent all night lying flat, so gravity could not pull more fluid down, and the system had hours to partially catch up. Now, before I continue, I need to stop and make something absolutely clear. There are situations where ankle swelling is not a drainage issue and is instead a signal of something that needs medical attention today, not next week. If one leg swells suddenly and significantly more than the other, and that leg is painful, warm to the touch, and red, that combination can indicate a clot forming in the deep veins. Stop what you are doing and get seen today. If both legs are swelling and you are having difficulty breathing, especially when you lie down, or you are waking up at night unable to catch your breath, or climbing a short flight of stairs leaves you winded, that pattern points toward a more advanced cardiac issue that goes beyond what any home approach can address. If you have noticed rapid weight gain, 4 or 5 pounds within a single week, combined with urine that appears foamy, that combination may indicate the kidneys are losing protein, and that requires blood work soon. And if you have swelling on only one side, it is painless, it feels firm, and you have a history of cancer treatment affecting lymph nodes in that area, that needs professional evaluation. If none of those situations apply to you, if your swelling is gradual, roughly equal on both sides, worse by evening and better by morning, and you have no trouble breathing at rest, then what follows is for you. There are 3 distinct patterns of lower leg swelling that appear most commonly after 60, and they look nearly identical from the outside but have completely different causes. The first is driven by the veins. The valves inside the leg veins have deteriorated. Blood pools rather than flowing efficiently back to the heart, pressure builds inside the vessels, and water is pushed through the vessel walls into the surrounding tissue. People with this pattern often have visible varicose veins and a brownish or reddish discoloration on the shin just above the ankle. The swelling tends to be especially severe after long periods of standing. The second pattern is the lymphatic one, the focus of this video. Lymph drainage has slowed. The tissue is saturated with fluid that has no efficient pathway out. The swelling is soft and leaves a pit when pressed. It tends to feel puffy rather than tight, and it often extends to the top of the foot, right behind the toes. When this has persisted for years, the skin on top of the foot becomes so thick and fibrous that you cannot pinch it between your fingers. Clinicians use that as a sign pointing toward chronic lymph congestion rather than venous or cardiac causes. The third pattern involves the heart or the kidneys struggling to manage overall fluid volume. The swelling is symmetric, grows through the day, and comes packaged with other symptoms: shortness of breath, frequent nighttime urination, profound fatigue, and sudden weight gain. If that is your picture, the conversation belongs with your physician, not a home protocol. The majority of people over 60 with routine evening ankle swelling and no other symptoms fit the second category. I want to tell you about a patient I will call Margaret. She was 69 years old, a retired nurse, someone who understood the body well and was not prone to catastrophizing. For about 2 years, she had noticed her ankles gradually thickening in the evenings. She had always been active, but the swelling was progressing and the shoes she had worn comfortably for years no longer fit by late afternoon. She raised it with her doctor. An echocardiogram was ordered. That is an ultrasound of the heart. and it came back normal. Her heart was pumping well. She was given a diuretic anyway. 6 months later, she was exhausted, constantly running to the bathroom, mildly dehydrated, and her ankles looked almost identical to when she started. She mentioned one detail that turned out to be the key to the whole picture. She said that when she traveled and spent the day walking around a new city, her ankles were noticeably less swollen. That single observation told me everything. Her swelling improved with movement and worsened with sitting. Her heart was fine on imaging. Her kidneys were fine on blood work. Her veins showed only minor age-appropriate changes. What she had was a lymphatic drainage system that had been slowing for years, and nobody had ever suggested the approach that would actually help it. Let me walk you through what was happening in her body every single day, because there is a very good chance the same pattern is running in yours. She wakes up in the morning, and her ankles look relatively normal. 8 hours of lying flat meant gravity was not pulling fluid into her legs, and the lymph system had hours to partially clear yesterday's accumulation. She gets up, makes breakfast, sits at the kitchen table, sits in the car for the drive to her volunteer work, sits at a desk for 3 hours, has lunch sitting down, sits again in the afternoon. By 2 in the afternoon, she has spent most of the day vertical, but almost completely still. Fluid has been leaking steadily from the capillaries into the tissue of her lower legs the entire time. Her calf muscles have barely contracted. The lymph drainage system has barely moved. The fluid is building up a teaspoon at a time. By evening, the sock groove is back. By 9 at night, the ring is tight. By 10, she lies down. And now a process begins that is the real reason her sleep was suffering. All that fluid that spent the day accumulating in her ankles, now that gravity is no longer holding it down there, begins slowly reabsorbing back into her bloodstream. Her heart receives an unexpected volume surge. Her kidneys detect it and produce urine to compensate. She wakes up at 2 in the morning, then again at 4, then at 5. By 6, she is exhausted, and the cycle begins again. There are 2 quick tests you can do right now that will tell you where you stand. The first is the indentation test. Locate the bony ridge along the front of your shin, about 4 inches above the ankle bone. Press your thumb into the tissue there firmly and hold it for 15 seconds. Remove your thumb and look at what remains. If there is a visible dent that takes 10 seconds or more to smooth out, that is what physicians call pitting edema. A slight shallow dent is mild. A deeper dent that lingers longer is moderate. A deep dent that takes over a minute to refill is significant. Write down what you find, because in 2 weeks after following the approach in this video, you are going to retest and the change will be measurable. The second test involves the skin on the top of your foot. Try to pinch a fold of skin from the top of your foot, right behind the second toe, and gently lift it. If the skin lifts into a fold easily, your lymph system is moving reasonably well. If the skin feels fused to the underlying tissue and you cannot lift it at all, that indicates a more advanced stage of lymph congestion. That specific finding has a clinical name, and it is one of the simplest and most reliable indicators a practitioner can use to identify chronic lymphatic backup without any equipment. 3 things that make lymphatic swelling significantly worse, and most people over 60 are doing all 3 without knowing it. The first is hidden sodium, not the salt you add consciously at the table, the sodium that comes preloaded in processed cheese, cured meats, canned soups, packaged breads, bottled condiments, restaurant meals, and frozen convenience foods. Your body holds on to a substantial volume of water in proportion to sodium intake, and the sodium ends up pushing fluid out of the bloodstream into the tissues. Most people over 60 are consuming roughly twice the sodium they believe they are. The second is sitting in the evening hours. The window between dinner and bedtime, when you finally sit down and relax, is also the window when your legs accumulate the most fluid. 3 hours of immobility right after the largest meal of the day creates almost ideal conditions for overnight fluid redistribution. The third is alcohol in the evening. Even a single glass of wine dilates the small capillaries, increases the rate at which fluid leaks from the vessels into tissue, and interferes with the hormonal signal your brain uses to slow nighttime urine production. One drink and your ankles will be visibly more swollen by the following morning. Now, the other direction. The things that actively support the drainage system. Water is the first one, and I know it sounds backwards. Most people with swelling instinctively drink less water because they assume more fluid intake means more swelling. The opposite is true. When you are dehydrated, the lymph fluid becomes thick and sluggish and moves even more slowly through the vessels. A properly hydrated body has thinner, more mobile lymph that flows with less resistance. Aim for roughly half your body weight in ounces across the day and begin tapering your intake after 5 in the afternoon so it does not disrupt your night. Foods containing natural compounds called flavonoids help by strengthening the walls of the small blood vessels, reducing the rate at which fluid leaks into the tissue in the first place. Dark berries, citrus, buckwheat, and red cabbage are the most accessible sources. Consistent intake over about 8 weeks produces measurable changes in capillary integrity. Protein is the third factor, and this one surprises people. There is a specific protein in your blood called albumin, and its job is to hold water inside the bloodstream. When albumin levels are low, which happens more commonly in older adults than most people realize, water escapes into the tissue and stays there. 2 servings of quality protein daily, from eggs, fish, poultry, legumes, or cottage cheese, directly supports the fluid physics that keep water where it belongs. And magnesium, which is deficient in the majority of people over 60, plays a role in the tone of smooth muscle, including the walls of the lymph vessels themselves. Pumpkin seeds, almonds, and dark leafy greens are among the easiest sources to add to a regular routine. Now the 5-minute bedtime habit. This is the core of everything I have been building toward. Every single part of it matters, and the sequence matters too. In the morning, before your feet touch the floor, while you are still lying in bed, do 30 ankle pumps. Point your toes downward, then flex them back toward your face, 30 repetitions. This takes under a minute. It restarts lymph circulation after 8 hours of stillness and helps prevent the immediate rush of fluid downward that happens the moment you stand up cold. During the day, every hour that you are seated, do 20 calf pumps. Keep your heels on the floor and raise your toes upward, then lower them back down. Or stand and rise up onto the balls of your feet 20 times. 30 seconds. Set a reminder if you need one. Before dinner, take 5 minutes to walk. Not a workout, simply movement. Around the block, through the house, in the yard. Walking engages the deep calf muscles in a way that seated pumps cannot replicate, and doing it before dinner means you are not accumulating a large backlog of fluid right before the evening hours when accumulation is already at its worst. 90 minutes before bed comes the piece that changes everything. Lie on the floor or on your bed. Raise your legs straight up and rest them against the wall at roughly a 90-degree angle. Heels above hips, hips roughly level with your heart. Stay in that position for 15 minutes. During those 15 minutes, do 10 slow ankle circles in each direction, then 20 alternating ankle flexes. Then, while still in that inverted position, place both hands flat on your abdomen and breathe slowly and deeply through your nose for 3 minutes. Let your belly rise with each inhale. This is not just relaxation. Deep diaphragmatic breathing directly activates the thoracic duct, the central drainage channel of the entire lymphatic system, which runs immediately behind the diaphragm. Every slow, deep breath is mechanically pumping your lymph. After 15 minutes, roll slowly to your side, come to a seated position, and then do something that looks simple but is clinically meaningful. Starting at your ankle, use the flat of your fingers to stroke the skin upward toward your knee. Slow, deliberate, always moving toward the heart, never in the opposite direction, 10 strokes on each leg. This is a condensed version of a technique called manual lymphatic drainage, and it physically moves fluid from the congested tissue into the lymph capillaries, where the system can then carry it upward and out. Within about 20 to 30 minutes of completing this sequence, you will likely feel the urge to urinate. The fluid you release will be pale and relatively odorless. That is not a coincidence, and it is not your imagination. That is several hundred milliliters of fluid that your lymph system just cleared from your legs while you were awake and in control of the process. That is the fluid that otherwise would have made that same journey after midnight, waking you up in the process. Margaret followed this approach for 3 weeks. By the end of the first week, her sock marks were gone by the following morning. By the end of the second week, she had stopped waking up in the night. By the end of the third week, her ankles at 9 in the evening looked the way they used to look at 9 in the morning. Nothing had changed in her prescriptions. Nothing had changed on her cardiac imaging. What changed was that her lymph system was being given a working window with the right conditions at the right time of day, instead of being left to struggle overnight while she was trying to sleep. Here is where I want to hear from you. After you have followed this protocol for 2 weeks, go back and run the indentation test again. Notice the difference, and then come down to the comments and leave me 2 things. First, your age. The age of this audience genuinely shapes the topics I focus on in future videos, and I want to know who is watching. Second, leave a comment telling me what you would like the next video to cover. I take those suggestions seriously, and there is a good chance that what is on your mind is on the minds of thousands of other people watching this channel. Your input directly shapes what gets made next. If someone in your life is dealing with ankles that swell by evening and has been told it is their heart, or given a prescription that is not helping, please send them this video. They deserve the explanation that most clinical appointments simply do not have time to give. And if you have not subscribed yet, do it now. Hit the bell icon so you get notified every time a new video goes up. This channel is building something, a place where these explanations actually get made. And the people who subscribe are the reason it keeps going. Your ankles are not broken. They are part of a drainage system that has been missing the signals and the conditions it needs to do its job. Give it 5 minutes in the right direction, and the results are not subtle. They show up in how your shoes fit, how your mornings feel, and whether you sleep through the night.